Debate, reprise de débat. The honourable member for Huron-Bruce.
Thank you very much, Mr. Speaker. It's a pleasure to rise in the House today and discuss this motion. Just to review it, the motion is that the House recognize the devastation that Ebola is wreaking in Western Africa and the serious threat to public health that the virus could pose to Canada, and call on the Minister of Health, the Chief Public Health Officer of Canada, and the Minister of Public Safety to appear before the Standing Committee on Health twice monthly to report on Canada's efforts at home and abroad to ensure that the outbreak does not pose a threat to the health and safety of Canadians. So that's the motion that we're looking at, and I guess the attempt from the Liberal Party here is to have these people come to committee, which I'm a member of the Health Committee, and report back to the committee twice a month until further notice, I guess. There's no start time, there's no end time, there's no nothing in the motion that mentions that the Minister of Development appear, who would also be a liaison in this. I really disagree with basically the entire portion of the motion itself, and the reason I say this is the fact that if you go on the website of Health Canada, they have everything they're doing. It's right there in real time. The minister and the Chief Public Health, they've had press conferences, they've put out press releases, it's in the news every evening. So the information is out there, the information is getting to Canadians. The province, all the provinces are working together. They're working with the minister, they're working with the public health units, the local health units as well. And actually, in Ontario, the Liberal government and the Liberal minister, Dr. Eric Hoskins, actually complimented the minister on television a few days ago and pointed out what a great working relationship they have on this issue, and how provinces, ministers, public servants, everybody involved, and obviously all the health officials are working to make sure, A, that Ebola doesn't come to Canada, but most importantly, if it does come, that they have the ability to recognize it, detect it, treat it, and make sure that the healthcare officials that are providing frontline care are protected when doing their job. That is, I think, an important comment, that when you hear somebody from a province who, in this case, is a different party than ours, complimenting and rising above partisanship and actually stating the facts as what is taking place. I feel that's what I feel, and I feel that the idea behind a lot of this is recognizing the fact, what's the federal government's role and what are the province's roles and the local health units and the local hospitals. So I think each area is doing their job, and they're working collaboratively. Just the other day, the response team, federal response team, was in Nova Scotia doing a trial run, and again, a further example of how each level of government is working, each agency is working to make sure that it is done correctly. We have been doing what's been asked of us by the WHO. We have delivered both in dollars, in personal protective equipment that we've sent over. So we've been there. Obviously, we want to work with the WHO to make sure that we're addressing the issues in Africa, that we're trying to contain the issues there so that they don't spread to Canada. Travel advisories are obviously been set up, and other air traffic coming into Canada, direct flights are not available in many cases. So these are important facts to show what we have done. But back to the point about the actual process that the parties brought forward, the Liberal Party on this motion. The committees themselves, the actual mechanics of the committee is maybe not the best avenue in my mind for this work to be done, and I'll point out why. Because the way they're set up in the standing orders in the committees, basically you'd have the minister there, as it would read, the chief public health officer there, and the public safety minister would be there, and they would each have 10 minutes or 15 minutes to present their information. Well, that information is already in the public domain, all that information, and it's available. And the Liberal Party would have 7 minutes to ask questions. Canadians are being informed. That's the point. Canadians are being informed. Anything that would be presented at the committee is already in the public domain. If members of Parliament, and specifically the Liberal Party, if they need information or they want information, the minister literally sits right across from them. If they had a question, they could come over and ask her during question period. They know all the minister's staff. They could contact their staff. The information is flowing. There's not a problem with information. All the information is in the public domain. The other important thing is that we're not resting on our laurels. We are working, like I said, with World Health Organization, but we're also monitoring very closely what has taken place in Texas and working with the Centers for Disease Control to make sure that if there are any areas for improvement, that we are taking those actions. So it's important to recognize that you can always improve, you can always do better, you can always find ways to make those important frontline healthcare officials as safe as possible, because we do know how these are transmitted. We do know how it is transmitted. Now, one thing I wanted to talk about here with prepared notes is was one of the institutions or institutes, and it's the Institute of Infection and Immunity, or III. And CIHR supports the research and helps build capacity in the area of infectious disease and the body's immune system. In addition to supporting research, III plays an important role on infectious disease issues in Canada, including helping to coordinate Canada's rapid research response to infectious disease outbreaks, especially those caused by new and emerging pathogens. To respond to these emerging threats, CIHR's III has led the effort to strengthen Canada's vaccine research landscape through strategic investments, leadership, and partnership activities. For example, starting in 2006, CIHR III led the development of the Pandemic Preparedness Strategic Response Initiative, and our government made an investment of $21.5 million. So you see, a lot of these investments have been made some time ago so that we are prepared as a country to protect our citizens from these outbreaks. It showed tremendous leadership in developing this initiative by forming linkages and building partnerships with provincial, federal, and international stakeholders. Like I mentioned earlier in my comments, these partnerships increased the total amount of available funds for research from $21.5 million to $43.3 million. This investment allowed CIHR to support more than 92 projects involving 345 researchers across the country. These projects supported through this initiative produced a variety of research and commercialization outcomes. For example, over a third of the projects researching vaccines and immunization produced results that could lead to a new drug or vaccine. So, Mr. Speaker, there's no doubt about it. We have done a great job both working with our partners abroad and locally, and I think all should be commended to this point. I do have an amendment to the motion, and I move, seconded by the member from Yukon, that the amendment be amended by A, replacing the words "the relevant minister and ministers" to appear twice monthly with "the Minister of Health," and B, replacing the words "monthly" with "as soon as possible" before. Thank you, Mr. Speaker. I'll now take questions.
Order, please. In order for an amendment to an opposition day motion to be put forward, the mover must have the approval of the mover of the original motion. I see that the honourable member from Vancouver Centre is here. Does she give consent for the amendment?
No, Mr. Speaker.
In that case, questions and comments. Questions and comments. The honourable member for Winnipeg North.
Thank you, Mr. Speaker. I know that it's interesting in terms of the presentation the member has made in regards to the motion. I think it's a genuine attempt to try to recognize that the government does have a responsibility, and all indications, at least in some of the discussions I've had with some of his colleagues, is that they're at the very least open to the amended motion as it's currently being debated. My question to the member is, does he not recognize that there's a totally different atmosphere in terms of going into a standing committee when you're meeting with for 2 hours and there's an opportunity to create a lot more dialogue than there would be during a question period or something of that nature, that in fact Canadians would benefit by having a committee where you get these different ministers dealing with an issue that is of great importance.
The honourable member for Huron-Bruce.
I thank the member for his question, but I'll go back to the point I made. If they want any information that they somehow can't get a hold of, the minister sits right in front of them. They could go over at any time and ask, and if they still feel like they need more time, they could arrange for a meeting with her in her office, her staff, the parliamentary secretary. Any information that isn't, or they have questions about, they can do it. And my point was, if they have questions, they have 7 minutes in that committee meeting. Well, I've witnessed for years the questions, and usually they have a 6-minute, 59-second question and 1 second for an answer. What I'm trying to tell them is, why don't you just arrange, if you want to have a meeting, meet with the minister, meet with their staff. They're always willing and available to have a meeting, and it's a far better use of everybody's time, and they're going to have the ability to ask more questions. I think it's a great thing.
Questions and comments, honourable member for Parkdale High Park.
Thank you, Mr. Speaker. And obviously the NDP believes that the Canadian public needs to be well informed when it comes to situations like a health crisis. People want to know that they and their families are protected by the government, and they need to have faith in the government and their public health agencies to be sure of their safety and security in these situations. And I want to ask a question specifically about the vaccine, because the government was slow to get the vaccine to trials. And with respect, the member opposite has said, well, you can ask a question of the minister, but we have not, the leader of the opposition has been asking this question. We've not been able to get the answer. The government sold the rights to a made-in-Canada vaccine for Ebola for only $200,000, and the Americans were able to get their vaccine to trials 1 month before Canada did. And the minister has done nothing to expedite the trials. So my question is, what steps did the government take to get the vaccine to trials before September? And why did they fail to intervene and ensure that this vaccine was available?
The honourable member for Huron-Bruce.
I thank the member for the question, and my thoughts are, a lot of the time the NDP just get it plain wrong, and I think it's been proven through the years that they do get it wrong. And the point is, the front line workers, okay? The front line workers. The vaccine's one thing, the front line workers, okay? They are getting prepared. They are preparing. They're improving every single day to make sure that Canadians are safe and protected if there was a case of an outbreak. Okay, that's the most important thing. The vaccines, that's one thing. Granted, it's one thing, but based on the evidence and the facts that we have today, The priority needs to be sure that if there is an outbreak, that all the frontline workers are protected, they've been educated. It's a big job. And we've heard from the Liberal health minister in Ontario, Dr. Eric Hoskins. We've all heard what he's had to say, and he feels very confident. He's obviously concerned. He has a big job to do. But he complimented the way our government is working with their government. And we're doing that from coast to coast. So I think the NDP should get on board and work with the minister a little better in what they do.
Resuming debate.